I'm Wilmer Matthews. I've been in Barry's Bay for over 40 years. And the gentleman next to me is my family doctor until he retires for over 40 years. So we kind of know each other very well. And I'm going to focus my remarks on the impact on local businesses. I think it's fair to say that people who don't know, Barry's Bay is just a very small community of 1,200 people who rely on small businesses to make the engine run, which means that local people are employed here. Some of them, and this is important to know, to make ends meet, work in more than one location, which in terms of COVID is also could be a contributing factor to problems when encountered. We're also heavily reliant on visitors, tourists, to keep our economy going. The only large operations we've got in Barry's Bay are local lumber mills, and believe it or not, the school, which is about a third the size of what it was when I came, and the hospital, and that's it. So as the pandemic ebbed and flowed, so did the businesses. At the very beginning, there was restrictions of different kinds put on in terms of limited seating, personal protection, equipment that needed to be purchased, all at their expense, and training of staff, and cleansing in the case of restaurants, cleansing the areas, the public areas, and also in the grocery stores, all taking time and energy on the part of the staff, and also costing the owners profit margins. In addition to that, the flow of traffic in the Barry's Bay started to slow down because people were concerned, and rightly so, not knowing at the time the total ramifications of the COVID epidemic, which again created problems with money. We thought we were pretty good for a while, but then eventually it came in and took hold. Then, of course, the restrictions increased to anywhere from partial shutdowns to total lockdowns. And I don't need to belabor the fact that this cost our businesses dearly in terms of not only their profit and survival margins, but also the staff that they hired who had to be laid off. So the effect was very, very wide-ranging and severe. And as the vaccines started to roll out, there was some optimism that yes, given time, the vaccine will take effect and actually work, because when it first came out, I don't think anyone knew definitively how good it was going to be. Well, since then we found that it's actually very, very good, and has created protection for as many people who are smart enough to take it. And with the help of the Renfrew County Health Unit and Dr. Cushman's leadership, he was able to get a good supply of vaccines into our area. So we didn't have shortages, at least none that I'm aware of. And people were starting to line up. The rollout of the vaccine was excellent. The health unit did a fabulous job of bringing the vaccine to the people as much as possible, rather than having us drive, because Renfrew County is very, very geographic. A lot of people don't have transportation, and if you have to drive into major centers like Pembroke or Renfrew, for us in Barry's Bay, that's an hour or more away. The other most alarming thing that I find as a community member is that there are some, and very few, who have taken the stance that for whatever reasons they have, none of these protocols are important to them, or don't affect them, or they want to gamble with the virus, or whatever it is, which to me is a very selfish approach. And I want those people however small their number is, to know two things. One is that they have a social responsibility to the rest of their family and friends and community at large to do what they can to not allow the virus to spread any further in the community. And secondly, they've got to realize that when one person gets sick, knowingly or unknowingly, because the symptoms can be asymptomatic, as we all know now, that it affects so many more. And I'm sure Dr. Joe will talk about tracking and so on, if not Dr. Cushman will. It affects so many outside their area. In fact, they don't even know who they may have infected. And a good example of that is just in the last 2 weeks, we've had 4 businesses shut down for periods of 4 to 5 days. And the latest one is still shut down, the local Tim Hortons franchise, believe it or not, because of people getting sick, spreading the virus, and now the health unit is busy spending a lot of time, and correctly so, tracking people down, getting them tested and so on before they allow the business to open. So I say, quite bluntly, enough is enough. All of us know or should know at this point that vaccines work, that social distancing and hand washing work, and masking definitely works because this is a virus spread through the air. So I will close with that. It comes down to personal responsibility. Kudos to those who are taking it, and not kudos to those who aren't taking it. And I just remind them, you may have rights, but that should not infringe on the rights of everyone else around you in the community who are concerned about public health. Public health concerns trump everything else. So with that, I'll close.